In health news this morning, if you suffer from sleep apnea, well, you're not alone. Over 22 million Americans suffer from this condition. It's important to know the causes and symptoms of sleep apnea and what treatment options are available to you. Joining me from the Mercy Health Sleep Center is Dr. Christopher Morgan. Good morning, Dr. Morgan.
Good morning.
Well, we all know between the two of us who's more attractive now, don't we?
It's like perfect story leading up to this.
Yes,
right?
I look over and I see you have a full beard on your face. Thanks for being on the show this morning. Talk a little bit about sleep apnea and basically, for those who might know what that is. I mean, is snoring sleep apnea? I mean, when you snore, does that mean you have it?
Doesn't always mean you have it, but you know, for the people that start getting really loud snoring and disruptive snoring, they almost always have some sleep apnea.
And so there are different levels of this, right? Sleep
Absolutely,
apnea.
yeah.
Okay, and what we're talking about today is obstructive sleep apnea. What does that mean?
Correct. So obstructive sleep apnea is when the back of the throat has blockages and people can stop breathing when they sleep at nighttime and can have potentially serious health consequences.
Now, when you say people stop breathing, obviously that raises an eyebrow.
Yeah.
Okay, so people stop breathing, not to the point where they're going to pass out, but what type of health consequences does this bring when you repeatedly stop yourself from breathing throughout the night?
So as you can imagine, when you stop breathing, you don't get oxygen to the brain, to the rest of the body. It puts a lot of stress on the heart and the lungs and other parts of the body. It can lead to high blood pressure. There's increased risk for heart attacks and strokes and cardiovascular disease. And then also the sleep disruption can lead to a lot of daytime issues like mood changes and trouble getting through your day. Yeah,
fatigue, I'm sure, is part of that. You don't feel like maybe you got a full night's rest. But
right.
That long list of health effects that could happen due to sleep apnea or obstructive sleep apnea is something we'd all want to avoid. So when it comes to the Sleep Center, what you guys do at Mercy, what basically are the treatment options? I'm immediately thinking of the CPAP.
Right.
But
yeah,
people don't jump right to that, do they?
Right. Well, some people do. I mean, it's still the gold standard of treatment, so it's what we use for a lot of patients with sleep apnea. And they've made a lot of technological advancements in the CPAPs and the masks over the years, which have made it much easier to use and much easier to wear during the nighttime. So it is still a great treatment, but there are different treatments for mild sleep apnea, such as advancing devices for the jaw that pull the jaw forward away from the back of the throat and help clear out the airway. And there are other options as well for milder sleep apnea, like losing weight and sleeping in a certain position. But when you get to more severe sleep apnea, the CPAPs are usually the first line of therapy for treating patients. And then we have other surgical options available, such as the different surgeries in the back of the throat and then the Inspire device. So.
The Inspire device. Great segue into what exactly is. I think we're getting some video right now of what the Inspire device might be. Tell us what this is.
So basically, it's an implantable device. It's a simple outpatient procedure where they implant it, and it gives a mild stimulation to the nerve that supplies your tongue. So when you actually take a breath at night, this stimulation pushes the tongue slightly forward, so that the airway can breathe much more easily at nighttime, and you can sleep better.
Okay, I want to make sure I heard you correctly. So it's implanted in my body,
yes.
And while I'm sleeping, if it senses something, it sends a nerve signal that moves my tongue.
Yes. Okay. So you can see there's two leads on the video. There's one that sits on the chest there, and when you breathe in, it senses that, and then it sends a signal to the tongue to move forward. And it's a very mild stimulation. It's not meant to wake you or disturb you at nighttime.
Sure.
So it's kind of gentle.
Fascinating video. Didn't know that existed. Who's a candidate for this? Is it only those who have severe or obstructive sleep apnea?
So moderate to severe obstructive sleep apnea is the best candidate, and someone who's non-obese, so typically BMI less than 35 to be considered to be a candidate for it.
Okay. So if people want to learn more about this, I'm sure there's a place they can go. Inspire Therapy. You're registered for. There's a free community talk being held. Are you going to be part of that?
Yes, yeah. I'll be doing the community talk.
That's your talk, isn't it? You're the headliner. February 18th at St. Mary's. To register for the event, just visit inspiresleepevents.com/events. All the information right there on your screen. And I'm sure you'll be able to answer any other questions people may have about this Inspire event or Inspire device that helps with sleep apnea.
Yep.
Thanks for the time, Doctor. Appreciate it.
You're welcome.
That's
Thank you.
fascinating stuff.